Welcome to the Gold Ribbon Podcast with your hosts, Sophia Garcia and Taskin and Sophia. Tune in as we interview those affected by childhood cancer, gather their perspectives, and help others find comfort in their expertise.
We'll be talking about pediatric cancer across the globe, within hospitals, government, and social media. We'll be discussing the differences and similarities between them. Sophie, why do you want to be talking about this topic?
So I feel like this is really important to talk about just because in a lot of areas, I feel like access to pediatric cancer treatment is not as available as it is in the US, and we're in a very privileged area. So I think it's really important to acknowledge the people that may not be in the same privileged situations and as a result may have a harder battle with pediatric cancer. So I definitely think this is an issue that needs a lot more awareness brought to it. So yeah.
I agree as well. I've wanted to focus on a lot about the financial situation and also the racial and sexuality situation that we have within different countries. So to start off, what I found was that cancer disparities include race and sexuality. And so cancer.gov states that despite having similar rates of breast cancer, Black African American women are more likely than white women to die of the disease. The rate of smoking and alcohol drinking, which increase cancer risk, are higher among lesbian, gay, and bisexual youths than among heterosexual youths. So the question we have to deprive and solve from this information is why this is happening. What outside factors cause people of these groups to turn to cancer-causing products, and what we can do as a community to lessen it. We have to realize that cancer disparity based on race, religion, ethnicity can be caused by the discrimination that is built within the healthcare system and the government and the social and economic class that causes people of color to be subjected to being part of lower income communities or subjected to bias from healthcare providers or just mistrust from healthcare systems itself. And we also have to start realizing that a lot of the research we have right now is not based on minorities. They're based on other groups of people, and we can't apply this research to minorities if it's not even based on minorities. We have to do some policy changes to overcome the systemic and racial problems that we see within our healthcare system, particularly with childhood cancer.
Yeah, I think that's really important what you brought up about this whole idea of systemic racism, and also, I don't know if this is a term, but systemic homophobia. It's a really large thing, and because of it, we've over a large time, over a large period of time, we've just subjected people of color and also other people to worse circumstances, and they're living in worse circumstances, and as a result they have a lack of access to the things they need. And yeah, I also think what you brought up originally about social media, that's also a really big thing, because in a lot of areas social media is the main source of information that a lot of people have, and without that a lot of people are lacking resources to maybe a post about certain cancer symptoms that you should look out for or things like that. A lot of people don't have access to that, and as a result they may not know if they do have something.
That's a really good point you brought up about social media. I didn't do enough research on particularly on social media and its effect on how fast cancer is diagnosed in certain countries. But from the research that I found, specifically on financial situations, on how people don't get screenings earlier on because they can't afford it or anything like that. One problem that I saw was cancer diagnoses aren't diagnosed right away, and so oftentimes these people from other countries are coming in to doctor offices with they're already past so many stages of cancer, and so it's hard to fight that. And so I think with social media, because social media is such a huge part of our lives, with social media we can honestly find other ways to help people, and they could honestly, as you said, they could search up symptoms of cancer or anything like that just to make themselves aware about it.
Yeah, and a lot of the research I found a specific image that showed different statistics about the frequency of cancer on different continents. So in North America, it was for children, it was 97.2, and adolescents, it was 98.1, compared to in Asia and Africa, for children, it was 6.3, and then 5.3 in Africa, and for adolescents, it was 5.3 and 2.6 for adolescents. So I feel like that's just shows how big of a disparity it is. Like, and also even just North America to Europe, for children it's 97.2, but in Europe it's 66.4. And even though that's a lot better than the compared to the 5.3 and the 6.3 in Africa and Asia, I think it just shows that a lot of people may take this information as, oh, in North America we just have a lot more cancer cases, but that's not the case. It's just there's a lack of research done in other areas, and because of this we think that like certain populations have more cancer, but the reality is that other populations just are misdiagnosed or not diagnosed enough. Like you said, a lot of people don't have access to um like just the resources they need to get diagnosed, and also like social media also plays a role in that, but it just shows like how different it is.
So, I totally agree with you about that. It's not that there's more cases within North America that's why so many people like there's so much fear with it. No, because there are cases within these countries that aren't focused on a lot. Like for example, from something that I found what that was interesting was that according to cancer.org, in 2020, out of nearly 10 million cancer-related deaths worldwide, 70% were in low and middle income countries. What's even more disturbing is that, which was also found in this website, is that 90% of the preventable cancer occurs in low middle income countries. The fact that a good percentage of these cases are from low income countries because they do not have proper treatments, proper healthcare, pain relief, nor not even care support teams specialized in dealing with mental health is disturbing and upsetting enough. But the fact that prevention of cancer isn't even possible because screenings aren't advanced enough to catch on earlier on, or cancer prevention vaccines, or just the environment which they reside in is disturbing, because now the number of deaths from cancer for these countries increase to having both people who have cancer already to cancer that is preventable.
Yeah. I found a similar statistic about um how the like kind of just the likelihood, which is it's a very, very sad fact, but the likelihood of someone or of a child specifically surviving from cancer depends on the country they live in. Because in high income countries, one statistic I found was that more than 80% of children with cancer are cured, while in low and middle income countries, less than 30% are cured. And that's like over a 50% difference. And I just think it shows that it's like we just need more access to resources and research. Because also I was doing my research, I found that a lot of sources were saying that the treatment of childhood cancer can be cost effective in all income settings. So it's not that it's not possible, it's just there's a lack of research and just kind of wanting to provide these resources, because there are a lot of organizations working towards it, but it's just not an overall like movement that everyone wants to be involved in. Like with the doctor that we interviewed last week, she worked within St. Jude, and St. Jude is a hospital that provides um, free cancer care to patients. So if we have more organizations like this, especially in other countries that are trying to make cancer care more affordable and more accessible, then this is something that we can, like, this is an issue that we can solve, and more people will have access to cancer care, and as a result more people will be able to survive.
That's right. Honestly, if they had more resources, then we would see a difference in the percentage that you stated. I also found similar statistics about it. That what I found was that roughly 80% of children in resource rich areas will survive, while 80% of children in resource poor settings will die. And this is such a huge difference in number, that the number of children surviving within these rich communities is the same percentage expected to die in resource poor settings. And this just pertains to the idea of how financial burden is such a hardship while battling cancer. You don't get the proper resources to fight it. So these kids are set to suffer because of a disease they couldn't control. This just causes that fire to, to get that to get the government to actually have funding. And I mean, not just like a little amount, like what we know is 4% of the government funding goes to childhood cancer research. But we have to realize that the effects of cancer throughout all communities, not just rich communities that are favored. This isn't a race in which we're supposed to collect thousands and thousands of funds from these poor families. It's a matter of finding cure and better treatments to make sure that these kids can live a long, healthy life, because they don't deserve this.
Yeah. And just one specific example I found, one cancer that I found that it's the most common pediatric cancer in many parts of sub-Saharan Africa was Burkitt lymphoma, and about 90% of children with that disease in high-income countries can be cured with timely treatment. So it's not like it's lasting a very long time. They can get access to resources like high-intensity chemotherapy and also just supportive care infrastructure because a lot of lower-income areas don't have it. While about only 50% of children with the disease in places where resources are constrained and the treatment isn't as available, um, they're the only ones that can get cured. So it's like a 40% difference. We're just showing like all these different percentages, but it's just such a large difference. And it just shows that if there is more research and just more statistics done, because in a lot of these areas, like a lot of the research I was going through, a lot of them don't have statistics on the exact amounts of cancer or increases of cancer in certain areas. And like it appears that the incidence of cancer in children and adults is increasing more in higher income areas, but that's only because there isn't these statistics done in other areas. And while other people may not think it's important, I think it is really important because if we have more statistics over it, then a lot more people will care because they'll see the effects and they'll just see like the urgency. Because if we're not like hearing or seeing these effects personally, then a lot of people aren't going to care about the issue, which is even though it's a little sad.
Uh, so from the data that you just stated, you said that 90%. Can you state that data again?
Yeah. 90% of children with disease in high income countries can be cured with timely treatment, while only 50% of children with the disease in areas where resources are constrained can be cured.
So is that saying that high that even with high resources, like even if these resources were available to like the group right now, it wouldn't benefit them as much as like high income communities? Is that what the data is saying?
Yeah, I think it's just saying that the areas where resources are constrained, they don't have access to like high intensity chemotherapy, so
Okay.
not as many people can be cured.
And even with, I guess, like how I said how um they've like doctors who are within these countries, they see patients coming in with like they're already at stage 4 of the cancer. So it's like it's harder for these treatments, even if they have access to these treatments, it's harder for the treatments to actually work if you're in stage 4 cancer. It's just that we have to focus on how to prevent it in the first place, because a lot of these communities that they live in, they are exposed to so many things that could like lead them to having cancer, and we have to figure out as a community why they're exposed to such things, why how do we fight that. And also another thing is that the financial burden is also present through like as you said, the resources. And I found that there was a mere 18 hospital beds per 10,000 residents compared to high income countries with 59 hospital beds per 10,000 residents. So I guess that shows another way in how these resources aren't available readily to like these people from these countries. They don't even have enough hospital beds to be treated in. And this is just a matter of injustice from before their cancer journey and during their cancer journey. I mean, this is quite present within the numbers that we see. Only 5% of childhood cancer diagnosed in Africa are cured versus 80% in the rest of the world, according to AfroX, a nonprofit organization that helps African countries implement cancer prevention and control groups. This is such a huge difference in numbers. We can't possibly be content with trying to find cancer treatments and cures when we exclude such a huge portion of those that do have childhood cancer. And another thing you brought up was like the research that we have. So particularly like I was talking about how we don't have enough research on like these minority groups. We don't have enough research on these countries, and how are we supposed to fight like this problem if we don't have enough research on them? Because without like enough research, we can't show people that this is alarming. This we have to step up and we have to like change this right now.
Yeah, I think it's really important. And I feel like we've been talking a lot about how just like avoidable deaths from childhood cancer result from like lack of diagnosis or misdiagnosis or delayed diagnosis, and then also like lack of access to care or maybe even abandonment of treatment, which is something I also saw. But another source that I found was also um, just about how other factors may contribute to higher income countries having more incidences of childhood cancer, with like risk factors like air pollutants and tobacco and pesticide use, and also older parental age or fewer children per the family. And although these topics are debated and not necessarily true right now, I think it's also cool, like not cool, I don't know. It's like interesting to see how the different factors in different countries can attribute to different like statistics, I guess. But I also think that it's definitely more of a lack of like research and statistics. Because also like another, just to name another statistic that I found, um, more than 80% of childhood cancer patients in higher income countries survive 5 years after their diagnosis, while in many low income countries, the lack of access to care, late diagnosis, treatment abandonment, inadequacy of therapy, and financial burden make it so they may not survive, or they'll not survive for long after. Because even if you get cancer treatment, cancer it doesn't just go away. Like you can be cured from cancer, but you'll still have the possibility of getting different, just I think we mentioned this in one of our last episodes. Like, you can get, you're more likely to get issues like heart issues and other things like that. So it's like not something that can just go away. And in these areas where there's already a lack of treatment, if they also have to worry about like possibly getting something else like in the near future because of having cancer in the past, they may not have access to those resources, and as a result, they may not survive for that much after.
I'm glad that you brought up the point that we have to focus on also like the aftermaths of having cancer. This isn't just like um a something that, oh, after you have cancer it's done. It affects you mentally and physically after cancer. After you're you don't have cancer anymore. It's just I feel like a lot of times these organizations, we don't focus, or our community, we don't focus on the effects of cancer like after their cancer journey. I feel like we don't focus on like the mental aspects of it, or like as you said, the physical aspects of it. Like they're more likely to develop heart disease. So it's concerning that we don't seem to focus on like the aftermaths of having cancer. Like a lot of these countries, they don't have these necessary doctors or groups that could help them mentally, because cancer takes such a mental toll on your mental health. It's important that you do have it. And I feel like because of this financial burden, they do not have access to like the resources that we might have. Um, and also, I I feel like there's other factors that do play into the financial burdens. Like as I said, race and sexuality does play into it. Do you find any other factors that play into it?
Um, like causing cancer.
Yeah.
Yeah, so I found like that also the lack of access to vaccines in certain areas has also caused cancer in these areas, because they are infections that can result as a result of not getting vaccines or not having access to vaccines, like what we saw with just the pandemic that is currently going on. When vaccines first started rolling out, there was a lot more access to vaccines in areas like where we live in, which is very fortunate, like the US. But in other areas, there weren't as many vaccines, or there wasn't that much education on vaccines. Like I don't know if you see them, but I see these all the time. These like ads to get vaccinated, like on TV and things like that. A lot of people don't have access to that, and they won't think that it's that important, maybe. So even if they may have access to vaccines, which it's already limited access in these areas, they may not see the importance of actually getting these vaccines because they don't have a lot of access just to like educational materials. Um, so yeah.
Okay, so that's a good thing you related back to specifically on this pandemic, and I think that's important because the pandemic itself might have affected a lot of people because of financial burden. So I think that's a good idea that you brought it up, and that's a good connection as well. The vaccine thing, I've seen that compared to our country, other countries do not seem to have the same resources that we have in order to fight COVID. And so I've that's definitely unfair because not only do they not have access to like other resources, but they don't have access to like ongoing pandemic that's happening right now. And also, it relates back to social media. A lot of the information that we get right now is from social media. Our lives revolve on social media. And so, especially with this pandemic has honestly been helped a lot by social media for me, at least. And so, I feel like if they did have more access with social media, it would definitely help them more and educate them more on needing vaccines. Um, and yeah, I totally agree that they should have more access to other stuff.
Yeah. I also feel like a thing that's also important to talk about is also how pediatric cancer is handled within the government and how that will affect like care, things like that. Because in certain corrupt governments, um, they may not like know the governments may purposely not like relay how how to look out for symptoms for cancer or how cancer is treated and things like that. And although that's not like probably the biggest thing compared to everything else we talked about, I think that's also something that's important to consider because if the government's not advocating for disease prevention and things like that, then that's also a factor that can contribute to it.
The government definitely plays a role in within this because from our country itself, we're only getting 4% of funds from the government to childhood cancer research, which is ridiculous because you can't have only 4% of the funding going to research, especially when research is already limited within like minority groups. It's just upsetting that only 4% of it goes to this research. So government definitely plays a role in it, and I feel like they should like step up and make a bigger impact and like because the government has to be connected with their people. They have to be communicating with them, and because of this lack of communication that I've seen with the government and like the people, I feel like it plays a huge role in like the percentages we see of people being affected by cancer and the percentages of the children that are surviving from cancer in different countries.
Yeah. And just kind of one last thing I found from my research, we've talked about financial burden and how it plays a role, like briefly, but I feel like it's also really important to consider how uh, a child having cancer will affect the parents financially and how that will also affect the access to care that the child has. I found something that said that 29% of caregivers move residents because their child was diagnosed with cancer, and 33% moved because like they need more access to treatment, and also 1/3 of caregivers reported quitting or changing their jobs as a result of their child being diagnosed with cancer. So if a parent has to move, like let's say they we also didn't talk about geography that much, but geography is also a big part. So let's say a parent has to move because they're in a rural area or remote area and they don't have access to care, then they can lose their jobs or have to quit their jobs. Then they're not having a source of income, and as a result their child may not have as great of access to care, even though they're moving to give that child access to better care. They may not have all the financial like needs that they do to provide the best care for that child. So,
I've from the research that I've done for this episode, I've seen a case where a woman has to go from El Salvador to Texas specifically because her child has cancer, and the article didn't talk a lot about the financial burden that she had because she had to make such a big move, but it talked about how she took um what was available, like she took what she learned from like the diagnosis of her son and like having to move and like talking about it back in El Salvador when she moved back. So I feel like that's such a good thing. Like I feel like honestly, if the government isn't stepping up to do the work, then us as a community have to do it. And it's honestly something like inspiring to see that she takes the lessons that she's learned and then she takes it back to her home to implement within her community. And now she's going around telling people like, hey, how to prevent cancer, what to do if you're diagnosed with cancer, how to know the symptoms of cancer, because she doesn't want other people, other children to suffer just like how her child had to suffer and had to go to a whole different country in order to like actually get the treatment that he's supposed to get. And also, back to the coronavirus thing. I feel like um, even within communities that are like high resource, like they have a lot of resources, COVID has affected them as well. Because of COVID, so many jobs have been taken away, and it's been honestly difficult for people who have been diagnosed with cancer right now, like during this pandemic, and their parents don't have any. Their parents are like laid off; they don't have a job. So, honestly, like it doesn't even have to be like they started off as like a uh resource, like a community that doesn't have any resources. A high rich community can turn into easily like a community that has no resources, like how some families, they had a job, they were able to afford, and then as soon as the pandemic hit, they lost their job, and it's been hard paying off like bills for their childhood who has cancer.
Yeah, I actually didn't consider that much. Like that's really important. Just seeing not only how, like, not only talking about like the vaccines with the pandemic, but also just how the pandemic has affected the entire world, and also because the pandemic is so prevalent right now, like especially at the peak of the pandemic at the beginning, I feel like that definitely created more lack of access to care because even if you have like you were saying, even if you have the access to care, if you're like the entire world is shut down during a pandemic, your child's likely not going to have access to cancer care. So, yeah, I think that's definitely really important. And just kind of something to end it off, I feel like if you want to like help, ways you can help is just through social media and stuff, like spreading the word on just maybe just an informational post about symptoms of cancer. So maybe someone who didn't know, they'll know, and they now have the information and can spread it to other people. Like what you were saying, with the woman that did that, like she speaks around the world, like about how to prevent cancer and things like that. I think that's really crucial. And if more people are if they educate themselves, that's actually the first thing I feel like that's really important. If you're personally educated on a topic, you're going to feel more inclined to share it with others, and that'll just make things a lot better.
Totally agree. If you have to be educated about it yourself if you want to be able to educate anyone else, and also for bigger steps. Of course, it's difficult to do it, but what I found really admiring was people who make organizations in different countries, and then they talk about like as I said, like the organization within Africa, like AfroX, a nonprofit organization that helps African countries implement cancer prevention and control programs. I feel like that's really important and admiring that you can make an organization in another country and be able to like have an organization and tell the community like prevention on cancer. Like I feel like that helps so much going personally to like a country and making an organization. But of course that's not always like you can't always do that. It's not possible for everyone. But like the small steps can be just like as a community, like how what you can do. Like for example, as I said, like um according to like this information that I saw was that the rates of smoking and alcohol drinking, which increases cancer risk, are higher among lesbian, gay, and bisexual youth than among heterosexual youth. We have to, as a community, realize why they're turning to these cancer causing factors, why this is happening, what outside factors from our community or the people from our community is causing these people that aren't treated right to turn to cancer causing products, why they're involved within these cancer causing products. We have to realize that as a community, we have a lot of flaws too, and that we have to realize that, okay, in order to fix this, we have to like condemn other people. We have to tell them that, hey, what you're doing is wrong. And we have to like stand up with each other in order to like fight this.
Yeah, and obviously starting an organization is a really good thing, but how you're saying it's not always that easy, like obviously starting an
Yeah.
organization. But with things like even just Cancer Kids First, like Cancer Kids First, they have a lot of different chapters in different areas. So you don't have to necessarily start the organization, but if you just want to get involved in your area, create a club about an organization and also try to make just moves within your community, as Tess was saying, that's just really huge, and that's still just a really big thing. So
if you or someone you know are looking to support childhood cancer patients and help them to experience a better childhood but are stuck on how, Cancer Kids First may be the answer for you. Cancer Kids First is a nonprofit organization started by high schooler Olivia Zhang that aims to improve the childhoods of cancer patients. Through volunteer work, donations, and fundraising, and the creation of this podcast, those working with Cancer Kids First work to further its mission.
If you're interested, go to www.cancerkidsfirst.org/get-involved to get involved. Another way to support the mission of Cancer Kids First is to listen to this podcast and follow us on our Instagram and TikTok at the Go to Room Podcast and Twitter at TGR_on-air. You can also get in touch with us through our email, thegotoroompodcast@gmail.com. Episodes will be airing 2 times a month.
Before we end the episode off, we want to give our Sunday trivia shoutouts. Every other Sunday, we host trivia on our Instagram story, and participants that play until the end get the shoutouts in our podcast episodes. To play, make sure to check our Instagram at the Go Room Podcast.
The shoutouts will appear on the screen now. Thank you so much for joining us on this episode of the Go to Room Podcast.
If you have any ideas for or want to be involved with future episodes, make sure to check out the link in our Instagram bio.
Have a nice day, and we'll see you in the next episode. Bye!
Bye!